Hi, welcome to my channel. My name is Wendy. I am a recent RN graduate, and on my channel, we talk about all things nursing. My path into nursing has not been the traditional way, and I'm here to be an encouragement and an inspiration to all who find themselves in the same predicament that I once was in. Please stay tuned to hear my story. I have a bachelor's degree in kinesiology with an emphasis in pre-physical therapy. I was accepted into the nursing program at the school that I graduated from. The year I got in, unfortunately, was the year that the program got canceled. I pursued a degree in kinesiology because the degree requirements were also prerequisites into the nursing program. So once I graduated, I had most of my prerequisites done for the nursing program, and I just had like one class to take, two classes to be exact. And once those were completed, I started applying. As a student who holds a previous bachelor's degree in a non-nursing related field, I had three options. The first option was to pursue an accelerated Bachelor's of Science in Nursing, accelerated BSN program. Second was to pursue an MSN entry-level program. So that's a Bachelor's in Science of Nursing entry-level nursing program. Also for those who hold a bachelor's degree in a field that is non-nursing related. The third option was to pursue an associate's degree in nursing. It's just all about timing and money. As a student, you can list your pros and cons and figure out what works for you. In my situation, and if I'm gonna be honest, I didn't feel like I had a competitive GPA to get into both accelerated BSN and into MSN entry-level program. Another factor for me too was the expense. With a previous bachelor's degree, I had debt that I had accumulated from my bachelor's program. It was important to me to not accumulate too much debt in the process of getting an RN degree. What I had to focus on in my situation was to pursue an associate's degree in nursing. And that's what I did. It took me just a few months. They say 2 years, but it actually took less because I started in January of 2018 and I graduated in December 2019. It feels longer just because you have those breaks in between. However, those breaks were much needed. Any nursing program is hard, but I just felt like this associate's degree in nursing was really hard. And while I was in school, I got engaged, I got married, I was also working. I would not recommend it to anybody, but I had to go and I had to reach it. You have to really want it in order to get to where I got to because it was not easy. Now, while I was pursuing my bachelor's degree, I wanted to get my foot into the nursing field. The summer of my second year in college, I went and took some classes to get my CNA, Certified Nursing Assistant license, so that I could work in an acute care facility. A lot of the times they require that a CNA have a background in a nursing home for 1 year before you can work at an acute care hospital. However, I got very lucky where I went to school was a small town and what was available to me in that time was an acute care hospital. And so that was my first job. My first job as a CNA, as a nursing assistant, I gained all the skills I needed for bedside, talking to patient, caring for patient. I did everything else except give, medication, but everything else was familiar to me. And it was very helpful too because I was always surrounded with nurses who I could always talk to and ask more questions about maybe their experience, maybe about a terminology, maybe about something that they were doing in that time that I was interested in. If you're interested in going into nursing, I would highly recommend you try to get a nursing assistant job because it was very, very helpful to me. So I graduated in December 2019, as I mentioned previously, with literally no debt. And that is the highlight of the whole process. It takes a little bit longer, but I didn't pay anything. The hospital that I was working for as a CNA while I was in school, part-time, had a tuition reimbursement program that I utilized in order to pay some of my school fees, which was very, very helpful. Also, there was another program at my job where I was working as a CNA that would allow me to work less hours in order to pursue my schooling and to complete my degree, which was very, very helpful. If you find yourself in my situation, trying to figure out what path works for you, don't be discouraged. Something that worked for somebody might not necessarily work out for you. Do not be discouraged, be inspired. And that's why I'm here to share my story with you. A lot of the times, people discourage an ADN degree because of the job prospects. But I'm here to tell you that you can still get a job with an associate's degree in nursing. I have 2 job offers right now that makes me feel a little wanted. It's a great feeling, and it just goes to show that there is indeed work out there for nurses regardless of your degree. However, with a bachelor's degree in nursing, it allows you to have more options and the chance to apply to bigger hospitals. That's the one drawback that I find in looking for jobs. More hospitals are now requiring BSNs. The 2 jobs that I got offered are with the telemetry department, which is okay for me because I have that experience working in a tele-med-surg floor as a CNA. So it's just gonna be that transition moving from CNA to RN that's going to be a little bit of a challenge, but in terms of the environment, I'm familiar with and I feel comfortable going in as a new grad. Of course, I'm still nervous. If you find yourself in my situation, don't be discouraged, be inspired. If you have any questions, please put them down in the comments. I will reply to you. Also subscribe to my channel to hear more stories from me. I'm here to be your voice of reasoning and to offer you encouragement. Stay tuned for next time. Bye-bye.